Welcome back, everybody, to another deep dive into today's top healthcare and tech news. Let's dive right in.
Seems like AI is taking the spotlight in a lot of these articles.
Yeah, it's really remarkable to see its growing influence on healthcare. So we've got Hartford Healthcare launching HHC 2047.
HHC 2047.
It's a new virtual primary care service powered by AI.
Oh, wow. So like round-the-clock care?
Exactly, 2047 virtual access starting April 1st. And they're using K-Health's AI platform for this.
And looks like Lumeris is also jumping on the AI bandwagon.
Math.
They're launching Tom, an AI-enabled primary care service, also designed for scalability, reaching a wider patient base.
It really makes you think about the future of primary care access. Imagine getting care anytime, anywhere, without even leaving home.
Yeah, the potential is huge, especially when you consider the financial strain a lot of rural hospitals are facing.
That recent AHA report really highlighted those challenges, didn't it?
It did. The rise of Medicare Advantage is putting a lot of pressure on these hospitals.
Okay.
Well, Medicare Advantage often has lower reimbursement rates compared to traditional Medicare. It's putting a real strain on their budgets.
It's a complex issue, for sure.
Absolutely. And some hospitals, like Intermountain Healthcare, are adapting by focusing on long-term planning.
They're calling it a no-regret strategy.
Right. They're trying to stay adaptable to all these rapid changes in policy and technology.
Makes sense. And it's not just rural hospitals feeling the pressure.
You're right. Trinity Health, for instance, is focusing on something different.
Oh.
They're choosing organic growth and operational efficiency over those big mergers we see so often.
So they're kind of going against the grain.
In a way, yeah, and it seems to be working. Their latest financial reports show a pretty big improvement in their operating income.
Interesting. Now, switching gears a bit, Microsoft is causing a buzz with their new quantum computing chip.
Majorana 1, right?
That's the one. What are your thoughts on that?
It's got the potential to revolutionize computing. Imagine being able to analyze massive data sets to speed up drug discovery or even simulating complex biological processes.
So it's not just about faster computers, it's about tackling complex problems that were previously out of reach.
Exactly. The applications in healthcare seem almost limitless.
And it's not just Microsoft making waves. Apple is integrating its Apple Intelligence AI suite into its Vision Pro headset.
That could change how we interact with data in healthcare.
How so?
Imagine surgeons using the headset to access real-time patient data during a procedure, or therapists using it for immersive mental health treatments.
It's incredible to think about how these advancements could reshape healthcare.
It really is, but amidst all this excitement, we can't forget about the ever-present threat of cyber attacks.
It's a serious concern. The recent warning from federal agencies about ghost ransomware targeting healthcare organizations is a wake-up call.
It is, especially for those with outdated software. They're particularly vulnerable.
It's a stark reminder of the massive Change Healthcare cyber attack back in 2024.
Which exposed the data of millions of people, the largest healthcare data breach in history.
Exactly. These incidents show just how crucial robust cybersecurity measures are.
Protecting patient data should be the absolute top priority.
Now, shifting gears a bit, let's talk about patient engagement.
It's becoming increasingly important. Banner Health CEO texting program is a great example of this.
Oh yeah, I read about that. What started as a pilot program in a single hospital has now expanded to over 125 locations.
All because of patient demand.
They wanted that direct line of communication with leadership.
It shows that patients really value clear and accessible communication. And it's not just about communication. We're also seeing systems like Novant Health and Cone Health use analytics to improve self-pay collections.
So they're using data to enhance the patient financial experience.
Exactly. By analyzing payment patterns and preferences, they can offer more tailored payment options and make the whole billing process less stressful.
That makes sense. So AI seems to be popping up everywhere in healthcare.
It really is. The NAACD reported that a significant number of corporate directors,
30% to be exact,
believe AI will have a major impact on healthcare by 2028.
It's a clear sign that AI is not just a passing fad, it's here to stay.
Absolutely. But the same report also highlighted some of the challenges hospitals face.
Like what?
Measuring AI's impacts and figuring out how to scale its applications effectively.
Sutter Health's chief data and analytics officer recently spoke about those very issues.
It's understandable. We're still in the early stages of AI adoption in healthcare.
It's like navigating uncharted territory.
Exactly. We need to develop clear metrics for evaluating effectiveness and find seamless ways to integrate these powerful tools into existing workflows.
It's a balancing act, for sure. But despite those challenges, the potential benefits are undeniable.
Absolutely. Imagine AI systems helping to enhance security and compliance in the healthcare boardroom.
So AI could be used to flag potential risks, identify patterns of non-compliance, and even predict emerging threats.
Exactly. It could significantly improve decision-making and enhance governance in healthcare organizations.
Speaking of expansion, Duke Health recently acquired Lake Norman Regional Medical Center.
From community health systems, they're aiming to create a hub of excitement for regional healthcare.
We'll have to see how that acquisition plays out.
It'll be interesting to watch, for sure. Now, on a different note, Altru Health System is also making moves.
In what way?
They're focused on expanding healthcare access across their region.
So broadening their reach.
Exactly. They're emphasizing service expansion to ensure more people have access to the care they need.
That's great news, especially for those in underserved areas.
It is. Now let's shift our attention to a couple of retail giants.
Walmart and Amazon.
You got it. They're both increasing their AI investments in a big way.
To do what?
Optimize efficiency, improve customer experiences, and ultimately drive business growth.
So how does this relate to healthcare?
Well, their advancements in areas like supply chain management and procurement using AI could offer valuable lessons for healthcare systems facing similar challenges.
Interesting. So we could potentially see healthcare organizations using AI to predict supply chain disruptions, optimize inventory management, and even negotiate better prices with suppliers.
Exactly. It's a reminder that sometimes the most innovative solutions come from looking outside your own industry.
Absolutely. Sometimes the best ideas come from unexpected places. So are there any other industries we can look to for inspiration when it comes to solving healthcare's challenges?
That's a great question, and one we should definitely explore further. The business world, especially the tech sector, is constantly innovating, and there are undoubtedly valuable lessons we can learn and apply to the complex world of healthcare. But for now, let's move on to some other pressing healthcare issues making headlines today. It's interesting, we talk about all this potential with AI, but the Vive 2025 conference in Nashville really highlighted the reality of the healthcare gap.
In what way?
Even with all these tech advancements, over 100 million Americans still struggle to access consistent primary care.
It's a reminder that technology alone isn't a magic bullet. We can't just throw gadgets at deeply rooted issues like healthcare access and affordability.
Exactly. We need solutions tailored to the unique challenges of underserved communities. Just blindly implementing technology could actually make things worse.
So it's about finding that balance between embracing innovation and addressing those fundamental social and economic factors.
Absolutely. And speaking of innovation, Royal Philips and Mass General Brigham just announced a pretty interesting partnership.
I saw that. What's it all about?
They're teaming up to leverage AI and advanced data infrastructure to enhance patient care.
It seems like everyone's jumping on the AI bandwagon these days.
It's not just a trend, it's about using data analytics and AI to actually improve clinical decision-making and patient outcomes.
So what are they focusing on specifically?
Developing AI-driven solutions that can process massive amounts of healthcare data. Imagine AI algorithms finding patterns that could lead to more personalized treatment plans.
It's amazing how we can use technology to extract meaningful insights from all that data.
It's pretty remarkable. They're looking at everything from early disease detection to predicting patient responses to different therapies.
The possibilities seem endless. Now for something completely different. There's been a breakthrough in newborn dialysis treatment.
Oh yeah, Nicholas Children's Hospital just acquired a pretty special piece of equipment.
What is it?
The Carpedium Cardio-Renal Pediatric Dialysis Emergency Machine. It's specifically designed for infants.
So this is a game changer for newborns with kidney failure.
It is. It's a gentler, more effective dialysis treatment and a major step forward in neonatal care.
It's incredible how far medical technology has come. Now shifting gears a bit, Australia is taking a very digital approach to mental health care.
I read about that SANE received a pretty substantial grant
To do what?
to implement their digital psychosocial recovery program nationwide.
And this program is for?
Adults experiencing complex mental illness and trauma. It's set to launch in July 2025.
So they're using technology to expand access to mental health care services?
Exactly. It's a free program offering everything from one-on-one counseling to peer support groups.
It's amazing how we can leverage digital platforms to provide accessible and personalized mental health care support.
It's a real game changer. Now, on a slightly different note, there's a growing concern about a skills gap in the healthcare workforce.
In what area?
Digital health competencies. A recent consensus statement published in JAMA Network Open highlighted this issue.
So we're talking about training future doctors to be comfortable with using all these new technologies.
Exactly. The statement was developed by a coalition of international experts, and they're really pushing for digital health training to be integrated into medical school curricula.
It makes sense. We're preparing these future doctors for a world that already exists, but their education isn't keeping pace.
Right. They even outlined a framework called DECODE.
Decode.
It stands for Digital Health Competencies in Medical Education. It's aimed at establishing a global standard for digital health training.
So it's about giving them the tools they need to thrive in a data-driven healthcare environment.
Exactly. The future of healthcare depends on it. Now back to something a bit more positive. Banner Health CEO texting program is getting a lot of attention.
It's such a simple idea, but it's clearly resonating with patients. They value that direct line of communication with leadership.
It's about accessibility and responsiveness. And we're seeing other healthcare systems using data to enhance the patient experience as well.
Like Novant Health and Tone Health, with their analytics-based approach to self-pay collections.
Exactly. They're making the billing process less stressful for patients by offering tailored payment options.
It's a win-win for both the patient and the healthcare system. Now, speaking of positive developments, the CDC reported some encouraging news about the opioid crisis.
Oh, yeah. For the first time since the pandemic, drug overdose deaths in the U.S. have actually declined.
So finally, some good news on that front.
It suggests that all the efforts to address the opioid epidemic are starting to pay off.
It's a step in the right direction, but we can't let our guard down. The number of drug overdose deaths is still tragically high.
Absolutely. We need to stay vigilant and continue implementing comprehensive strategies.
Now let's talk about a health system that's taking a different approach to growth.
You're talking about Trinity Health? They're bucking the trend of mergers and acquisitions.
Instead.
They're focusing on organic growth and improving operational efficiency from within.
And how's that working out for them?
Their recent financial performance shows it's a viable strategy. They've seen a significant improvement in their operating income.
It's a reminder that there's no one-size-fits-all approach to success in healthcare.
Exactly. Now let's delve a bit deeper into the role of technology in healthcare delivery.
The landscape is certainly changing rapidly.
It is. The rise of virtual care has been particularly significant.
Telehealth and remote patient monitoring have become much more mainstream.
It's all about making healthcare more accessible and convenient for patients.
It's incredible how quickly we've adapted to things like video calls with doctors.
It's become the new normal. But there are still challenges.
Like what?
Ensuring equitable access to technology, addressing privacy concerns, and figuring out how to seamlessly integrate virtual care into existing workflows.
It's a work in progress for sure, but the potential is undeniable.
Absolutely. Now, what about AI in diagnostics and treatment planning?
That's another area that's rapidly evolving.
It is. We're seeing everything from AI-powered analysis of medical images to algorithms that can predict disease risks.
It's like having an extra set of eyes working alongside doctors.
Exactly. And AI is also being used to develop personalized treatment plans, taking into account individual patient characteristics.
It's a step towards more personalized and effective medicine.
But of course, with any new technology, there are ethical considerations.
Like what?
We need to be mindful of potential biases in algorithms, ensure data privacy, and maintain human oversight in decision-making.
So it's about using AI to augment human capabilities, not replace them.
Exactly. It's about finding that balance. Now let's shift gears and talk about something that's often overshadowed by all this talk of technology.
Physician burnout.
It's a serious problem, and it's driven by a lot of factors.
Long work hours, administrative burdens, the pressure of electronic health records.
It all takes a toll. And it's not just about the well-being of physicians. It also impacts the quality of care they provide.
So what can be done to address this?
It requires a multi-pronged approach. Healthcare organizations need to create supportive work environments that prioritize physician well-being.
So things like reducing administrative burdens, offering professional development opportunities, and fostering a culture of respect.
Exactly. And physicians themselves need to prioritize self-care.
Setting boundaries, practicing mindfulness-seeking support.
It's all crucial. Now, for some good news, the FDA has finally declared an end to the nationwide shortage of semaglutide injection.
That medication has been in short supply for quite a while.
Over 2 years, the demand just skyrocketed, especially for its weight loss benefits.
So this is welcome news for a lot of patients.
It is, but it also raises questions about long-term supply and equitable access.
Especially with the demand still so high.
Exactly. It's a reminder that ensuring access to essential medications is an ongoing challenge.
Now let's revisit the issue of financial strain on rural hospitals.
That AHARE report really painted a bleak picture.
It's a complex issue with multiple factors at play.
Declining patient volumes, lower reimbursement rates from Medicare Advantage plans.
It's putting a lot of these vital institutions at risk.
And the consequences of their closure would be devastating for the communities they serve.
So what can be done?
We need policy changes that ensure equitable reimbursement rates for these hospitals.
Right?
Supporting telehealth and other technology-enabled care models could also help.
It's about finding creative solutions to bridge those gaps in access.
Absolutely. Now, on a more positive note, Novant Health is shaking things up with their leadership structure.
I read about that. What are they doing?
They've redesigned their leadership operating model to enhance agility and scalability.
It seems like a lot of healthcare organizations are moving away from those traditional top-down hierarchies.
They are. It's about being more responsive to the rapid changes happening in healthcare.
So Novant Health is prioritizing collaboration and empowerment.
Exactly. They want to create a more adaptable organization that can quickly respond to evolving needs.
It's a good example how healthcare is adapting to the demands of the future. Now, on a more serious note, there's been a tragic incident at Mission Health.
A patient died in an emergency department bathroom.
It's a heartbreaking situation, and it raises serious questions about patient safety protocols.
Mission Health has terminated the employee involved, which shows their commitment to accountability.
It's a stark reminder that even in the best healthcare settings, errors can occur.
And when they do, we need to have systems in place to prevent them and take appropriate action.
Patient safety should always be the top priority. Now shifting gears again, Altra Health System is making strides in expanding access to care,
They're really focusing on underserved areas.
which is so important considering the challenges faced by rural and remote communities.
They're establishing new clinics, expanding telehealth services, and working with community partners to address those social determinants of health.
It's encouraging to see such a proactive approach.
It is. Now, unfortunately, there's also been some news about hospital closures.
United Medical Center in Washington, D.C. is shutting down in April.
It's another example of the pressures facing the healthcare industry.
Declining patient volumes, financial strain, difficulty recruiting and retaining staff.
It's a complex problem with no easy solutions.
These closures have a ripple effect, impacting access to care, economic stability, and the overall health of communities.
It's a serious concern. Now, on a slightly brighter note, Minute Clinic and Emory Healthcare Network are expanding their collaboration.
They're offering in-network adult primary care services at select CVS pharmacy locations.
It's an interesting approach, leveraging the convenience of retail clinics to expand access to primary care.
So patients can get routine checkups, vaccinations, and treatment for common illnesses.
And if they need more specialized care, they can be referred to Emory Healthcare Network specialists.
It's about meeting patients where they are, making healthcare more accessible.
Exactly. Now, for a development in medical research, Avandra, a clinical imaging data company, just received a major investment
To do what?
to expand their platform that allows researchers and clinicians to access and analyze massive amounts of medical imaging data.
It's like creating a giant library of medical images.
Exactly. Having access to such large datasets is crucial for advancing medical research and develop as new diagnostic tools.
It could really accelerate the pace of innovation.
It could. Now Vizient, a healthcare performance improvement company, has renewed their agreement with TPC.
TPC.
It's a network of independent health systems in Texas and Arkansas.
So what does this partnership entail?
TPC members will continue to have access to Vizient services like spend management consulting, data analytics, and digital solutions.
It's a good example of how collaboration can benefit healthcare organizations.
Absolutely. They can achieve cost savings, learn from each other's best practices, and implement innovative solutions.
Now let's give a shout out to a rural hospital that's doing great things.
Columbia Memorial Hospital just received the Rural Hospital Leadership Team Award from the American Hospital Association.
That's a prestigious award.
It is. It recognizes their exceptional leadership and dedication to providing high-quality care in their rural community.
What are some of the things they're doing well?
They've fostered a culture of continuous improvement focused on patient engagement and community partnerships, and strategically used technology to enhance care delivery.
It's a model for other rural hospitals facing similar challenges. Now, switching gears, AdvaMed is voicing some concerns about staffing cuts at the FDA.
They're worried that these cuts could hinder innovation and slow down the development of new medical devices.
The FDA plays such a critical role in ensuring the safety and efficacy of these devices.
They do. And with fewer staff, it could lead to longer review times and a backlog of applications.
It's a delicate balance between protecting public health and fostering innovation.
It is. And adequate funding and staffing for regulatory agencies are essential for striking that balance.
Now, for a story about supply chain resilience, Siemens Healthineers is making a strategic move.
They're setting up mega depots on both coasts of the U.S.
To do what?
Strengthen their supply chain and get deliveries to customers faster.
So they're being proactive about ensuring a reliable flow of medical equipment and supplies.
Exactly. The pandemic really highlighted the importance of supply chain resilience.
It did. Now, not all the news is positive. Community health systems. A large hospital operator just reported a significant loss.
In the fourth quarter of 2024,
What are they attributing this loss to?
rising labor costs, declining patient volumes, and the lingering effects of the pandemic.
It seems like a lot of healthcare systems are struggling with similar challenges.
They are. It's a tough environment out there with rising costs, changing reimbursement models, and evolving patient expectations.
Now, for a more innovative approach, the University of Texas system is focusing on integration and addressing physician shortages.
They want to leverage their vast resources to boost medical research and innovation.
With
They have 14 academic and health institutions. They believe that breaking down silos between these institutions will lead to a more integrated research and clinical enterprise.
It's an interesting strategy.
It is, and they're also tackling the physician shortage head-on, which is crucial for both access to care and innovation.
It's a reminder that solving healthcare challenges requires a comprehensive approach. Now, let's talk about a demographic trend that's having a big impact on healthcare.
The aging of the baby boomer generation.
It's leading to a significant increase in the number of older adults.
And older adults tend to have more complex healthcare needs.
So it's putting pressure on the healthcare system.
It is. Healthcare systems are adapting by expanding geriatric services, developing age-friendly care models, and investing in technologies that support aging in place.
It's about recognizing the unique needs of this growing population.
Exactly. Now, for a policy issue that's back in the news,
Medicaid work requirements.
President Trump's return to the White House has brought this issue back to the forefront.
It's a controversial policy with both supporters and opponents.
Supporters believe it promotes personal responsibility and self-sufficiency.
And opponents.
They're worried about people losing access to essential healthcare services.
It's a complex debate with no easy answers.
It is, and the outcome will have a significant impact on millions of Americans.
Now let's talk about a topic that's been generating some controversy, the use of compounded medications.
Compounding can be valuable, but it also raises safety concerns.
Especially when it comes to weight loss drugs.
There have been some concerns about telehealth companies promoting compounded weight loss medications without proper medical oversight.
The FDA has issued warnings about this.
They have. It's crucial to use compounded drugs only from reputable sources and with proper medical supervision.
Patient safety should always come first. Now, for a more positive development, Austin Hospital in Melbourne, Australia, is undergoing a major expansion.
They're investing $275 million to expand their emergency department.
Wow, that's a significant investment.
It is. They're upgrading their short-stay unit, adding more treatment spaces, and improving their clinical administration areas.
So they're responding to the growing demand for emergency services.
They are. It's all about providing timely and effective care to patients.
Now let's talk about a telehealth company that's making a difference in obesity treatment.
Flight Health.
What do they do?
They offer virtual care and support for individuals struggling with obesity.
So everything's done online.
Exactly. They provide personalized treatment plans, medication management, and behavioral therapy, all through their virtual platform.
And they're led by.
Catherine Saunders, one of the first obesity fellows in the U.S.
So she brings a wealth of experience to the table.
She does. This virtual model is removing a lot of the barriers that prevent people from seeking help for obesity.
It's making treatment much more accessible and convenient.
It is. Now let's talk about a company that's helping healthcare organizations with their revenue cycle management.
Excalibur Data-Driven Performance Management.
They just appointed Christy Pahanich as their Senior Vice President of Revenue Cycle Operations.
She's got a lot of experience in this area.
She does. She'll be leading Excalibur's efforts to help healthcare organizations optimize their billing and collection processes.
Revenue cycle management is so crucial for healthcare providers these days.
It is. They're facing increasing pressure to maximize revenue and control cost.
Now let's talk about a more specialized area of healthcare pediatric transport.
It's a vital but demanding field.
Transferring critically ill children between hospitals requires a high level of expertise and coordination.
And there's a growing shortage of qualified personnel.
So it's becoming even more challenging.
It is. Healthcare systems are trying to address this by investing in specialist training programs and creating regional transport networks.
It's all about ensuring that these vulnerable patients receive timely and appropriate care.
Now let's recognize a healthcare leader who's making a difference, Russell Cox, the CEO of Norton Healthcare.
What's he being recognized for?
His exceptional leadership and his commitment to fostering a culture of learning and innovation.
He's been in healthcare for over 40 years.
He has. He started his career as a teacher, so he brings a unique perspective to his leadership role.
And his focus on creating a learning environment has really paid off.
It has. Norton Healthcare has achieved high marks in healthcare quality and patient satisfaction.
It's inspiring to see leaders who prioritize both the bottom line and the well-being of their employees.
Absolutely. Now, for an update on a labor dispute that's been making headlines.
The nurses' strike at Providence.
They finally reached a tentative agreement.
After a long and difficult negotiation process.
The agreement still needs to be ratified by the union members, but it addresses some of their key concerns.
Such as,
Wage increases and improvements to staffing levels.
hopefully this will lead to a more supportive work environment for the nurses.
It should. This strike also brought attention to a larger trend.
The growing movement to unionize healthcare workers.
It's happening all over the country.
Nurses, physicians, support staff.
They're all looking for better wages, benefits, and working conditions.
And a greater voice in decision-making.
Exactly. It's a sign of the times. Now for a story about consolidation in the healthcare industry.
Kindred Hospitals is closing safe facilities in Chicago.
And consolidating services into their remaining locations.
They're citing financial pressures and declining patient volumes.
It's a trend we're seeing across the U.S.
Hospital closures, especially in rural and underserved areas, can have a devastating impact on community.
It's a real concern. Now let's talk about an important aspect of addressing health disparities, the social determinants of health.
These are the non-medical factors that can significantly impact health outcomes.
Things like poverty, lack of education, and environmental hazards.
They can create huge disparities in health outcomes.
They can. We need to go beyond just medical interventions and address these underlying social and economic factors.
It's a shift in perspective from treating illness to creating healthy environments.
It requires collaboration between healthcare providers, community organizations, and policymakers.
It's a holistic approach to healthcare.
Exactly. Now, Trillium Health Partners in Canada is launching an interesting study.
What's it about?
They're looking at ways to better integrate caregivers into health and social care teams.
Caregivers play such a vital role.
They do, and this study aims to develop strategies that can enhance caregiver support and improve care coordination.
It's a patient-centered and family-focused approach to healthcare.
Now let's shift our attention to the UK, where they're facing a shortage of dental care services.
It's a problem that's been exacerbated by the pandemic.
The government and the National Health Service are working to address this.
How so?
They're increasing the availability of urgent dental appointments.
So trying to provide more immediate relief?
Exactly, but long-term solutions are needed as well.
What are some of the underlying causes of this shortage?
A shortage of dental care professionals and the rising cost of treatment.
It's a multifaceted problem that will require a multi-pronged approach.
Now, for a company that's making maternity care more accessible, Millie, a U.S.-based maternity clinic, just secured funding to expand its services.
What do they offer?
Virtual consultations, personalized care plans, and access to a network of maternity care providers.
All through their online platform.
Exactly. It's empowering women to take control of their pregnancy and childbirth experiences.
It's a great example of how technology can enhance healthcare.
Now let's talk about a children's hospital that's using AI to improve care.
Akin Children's Hospital.
They're expanding their use of the A-Bridge generative AI platform.
What does that platform do?
It analyzes medical conversations and generates summaries, insights, and recommendations for clinicians.
So it's like an AI assistant for doctors.
It can help reduce documentation burdens, improve communication, and enhance decision-making.
It's an innovative use of AI in healthcare.
Now let's talk about Peep Health and their focus on patient experience.
They're working with ECU Health.
To leverage their AI-powered technology for analyzing patient feedback.
It's about using patient feedback to drive quality improvement initiatives.
Exactly. They want to create more patient-centered healthcare environments.
It's pretty amazing how AI can sift through all that data and find those nuggets of insight that can actually lead to better care.
It really is impressive. Now for a company that's expanding into at-home lab testing.
Hims and Hers.
That's the one they acquired, Tribe Labs.
So now they can offer lab tests that you can do right from home.
Exactly. It's all about convenience and giving patients more control over their healthcare experience.
It's like we're finally catching up to the on-demand world we live in.
Exactly. Healthcare is becoming more consumer-centric. Now let's circle back to a topic we touched on earlier, physician burnout.
It's a serious issue that deserves our attention.
It really does, and it's not just about the well-being of physicians. It affects the quality of care they can provide.
So it's a systemic problem.
Absolutely. Healthcare organizations need to step up and create more supportive work environments.
Reduce those administrative burdens, offer more professional development opportunities, foster a culture of respect.
Exactly. And physicians need to prioritize their own well-being.
Taking breaks, practicing mindfulness, seeking support.
It's all crucial for preventing burnout. And that brings us to the end of our deep dive into today's healthcare and tech news.
We've covered a lot of ground, from AI and virtual care to cybersecurity and physician burnout.
It's clear that healthcare is constantly evolving and innovating.
It's an exciting time to be following these developments.
Absolutely, and we hope you found this deep dive informative and engaging.
As always, we encourage you to stay curious, stay informed, and stay engaged in the conversations that are shaping the future of healthcare.
We'll see you next time.
Until then, take care.